Hi, welcome to another video, part of my series on comments on psych meds by Psychiatrist. Remember, these videos are for informational purposes only and should not be taken as medical advice. So today I'm going to take a step toward rounding out the category of SSRIs and talk about fluvoxamine or Luvox. As I just alluded to, it is an SSRI in the same category as Prozac, Zoloft, Lexapro, which I've already reviewed in previous videos. Fluvoxamine in particular tends to be reserved specifically for use in obsessive compulsive disorder, or OCD. It has been associated as being preferable for OCD, although it does have the same mechanism of action, and so therefore should be potentially effective for depression and anxiety, as all of the SSRIs are, and it can be used to treat the various depressive and other anxiety disorders, but as I said, tends to be thought of as particularly matched for the treatment of OCD. One other disadvantage of fluvoxamine is that it is best dosed twice daily as compared to all of the other SSRIs, which are once daily dosing medications. And for any medication, when you have to take it more than once a day, it's going to be harder to take it consistently, and therefore the effectiveness is going to be a bit reduced. So that is one disadvantage for fluvoxamine. It does come in an extended release form, which can be dosed once a day, so that alleviates this disadvantage a little bit, but it is not as widely used in my practice, and even for OCD, I'm aware that the other SSRIs can also be used for OCD in high dose. So I think the twice daily dosing, even though there is an extended release form available, does tend to reduce the popularity of fluvoxamine overall. I will generally talk about the dose range of these medications, but I use it so infrequently that I don't have anything to add in terms of the dose range, in terms of what I have seen as be effective. I tend to follow the package insert, and since I have relatively little experience with it, I don't want to just parrot out what's written on the label as if I can add to that from my experience. And that's the point of these videos, is to try to share what my experience has been. And so I think that that's actually relevant, though, the fact that I use it so little that I don't have a good personal reference point to the dose range that tells you something about medication. But I don't necessarily think that's a reason not to use it. I think that it is a viable option. I just can't share my own experience in terms of helping with provide any additional information about the dosing range. Coming off of it, again, this is based on more limited experience, but generally speaking, patients have not had a lot of difficulty coming off of it. As with all medications, I advise doing a taper, gradually reducing the dose, but I have not seen very significant difficulties in coming off the medication. In terms of side effects, beyond the sort of let me say this, that the thing that I associate with fluvoxamine is that some people do get tired on it. So for some patients that is a contraindication, but for the most part is generally well tolerated, and the biggest issue is keeping up with the twice daily dosing. And again, worth mentioning that, as with all SSRIs, there is the potential for sexual side effects. So that's true of all the SSRIs, and no different for fluvoxamine, and I would say definitely present for fluvoxamine. Just in an effort to round out the category, I did want to make a video about the medication, even though I don't use it as much as the other members of the class, and hopefully that provided a little bit of information about this medication, which again, I think is a good viable option when looking for options for treating OCD.